Hey, welcome to my channel. Thank you for joining me today. So today we are talking about non-alcoholic liver disease. So I have put out a video with regards to alcoholic liver disease. So today we're talking about non-alcoholic liver disease. So before I get into it, so my name is Joyce. I'm the face behind this channel. On this channel we talk about all things health, wellness, and also your mental health. So we touch on physical health and your mental health. If you are interested in that content, then stay with me, subscribe, like, and share. So today we are talking about a health condition which affects the gastric tract. So I'm doing a series on that. I have posted a few videos already talking about conditions which affect the tummy. So if you are interested in that stuff, then please look at the playlist, because I've done a playlist with regards to all of that stuff. So without much further ado, let's just head straight into the video. So what is non-alcoholic liver disease? So it is essentially, as the name suggests, liver damage, a liver disease which is not related to alcohol consumption. So in other words, this happens to people who don't necessarily drink alcohol at all. Why would someone have this disease, or what are the risk factors? What are the causes that someone would have this? The main one is being of a higher BMI, so being obese, and being insulin resistant, which again, you know, is very much associated with then being overweight. Having a high blood pressure is another thing, and having high cholesterol is another thing. So if you notice, there is a trend between what I'm mentioning now and diabetes. If you remember, I posted a video on diabetes as well. So these risk factors are very similar to the ones for diabetes as well. So just a side note. And also having a sedentary lifestyle where you are not moving, you're not exercising, you're not really doing anything except sit behind your desk and not really doing much else. So there we are. And being of advanced age. So the older you are, the more likely you are to then have a diagnosis of non-alcoholic liver disease. And a rapid weight loss is actually another risk factor for non-alcoholic liver disease. So if you lose weight, make sure you're losing the weight gradually rather than a very quick drop in your weight. That's not healthy overall anyway. And also having polycystic ovarian syndrome, which I have spoken about in a previous video as well. And that also is very much linked to the insulin resistance and metabolic syndrome, and also high cholesterol levels and stuff that I mentioned earlier. So non-alcoholic liver disease does not cause any symptoms at the early stages. It's only later on that you can then start having symptoms. And the symptoms are very similar to the ones for alcoholic liver disease. So what are those symptoms? So you will notice that you can have tummy pain, abdominal pain. As the condition progresses, you can then start having nausea and vomiting, unexplained. You can then start having jaundice. Remember, jaundice is always associated with some liver condition. So jaundice, so that's yellowing of the skin or yellowing of the eyes. And you can also have fluid buildup as well in the abdominal. So that's ascites, and you can have also other things happening. You can also have your liver can actually be enlarged as well. So when you go to see your clinician, they will examine you, just like I previously mentioned with regards to non-alcoholic liver disease. They will examine you and they will be checking for jaundice. They'll be checking under your eyelids, checking your skin, and also checking your tummy to see whether you have ascites, fluid buildup, or if you have a larger liver. So those are the things that your clinician is likely looking for. And then after they've done that, they would request for a blood test. The blood tests are checking your liver. So you have liver blood tests, your GGT, and they'll also check your clotting screen and to see if there's anything else going on there. They might have other additional blood tests to exclude other conditions as well. In terms of imaging, what they would request for initially, it's likely to be a scan of your abdomen, and in that scan it will assess your liver as well. It will look at the size and other things, and they can deduce that there is, liver disease. And if that is the case, in primary care we would then refer you to secondary care, where you can then have other further tests, and also a plan can be made in terms of management. So you might be asking, what then can you do yourself to reduce your chances of having non-alcoholic liver disease? One thing is having a healthier lifestyle. Pretty much similar things that I would advise someone who is pre-diabetic, so they're not officially diabetic, but they are heading towards that direction. So definitely lifestyle is very key. A healthier lifestyle, moving more, and being more intentional with even the times that you're eating as well. It's very important to be aware of when you're eating. You're not eating in the middle of the night, not ideal, not advisable. And also making sure that you are doing exercises that you enjoy. So I have done videos with regards to that as well. So I won't carry on anymore. I think this is enough. I do hope this has been helpful. If it has, then share it with someone who maybe might benefit from this. Or if you've noticed someone is maybe having jaundice or having tummy pain, then consider sharing this with them, and they could see their health professional and just make sure that everything is fine. So I won't waffle anymore, so I'll leave you and I'll talk to you on another video. Please do share, subscribe, comment. That will be very helpful. That is helpful for a growing channel as this one. Thank you so much for joining me. I will talk to you another time. Please tell me what you would like, which series you would like us to talk about next. I am considering doing a mental health series, so let me know if you would be interested in that, or if you're interested in something else. Let me know. Take care. Bye bye.